Hi, I'm Jody Starcher, a patient of Dr. Widmer.
Jody is a 47-year-old female who presented to my office with severe bilateral hip pain.
It was getting to the point that it was difficult for me to do my daily chores, work, go to the grocery.
Jody had hip dysplasia, which is a disease of the hips, which affects young females, sometimes requiring treatment in pediatrics, sometimes mild enough that it goes unnoted until we're young adults, and shows as severe osteoarthritis of the hip at a young age. If we examine the patient's x-rays here, the left side of the image is actually the right hip and the right side of the image is actually the left hip. Patient had severe loss of joint space on the right, and she did have some leftover joint space on the left. You can see here that the patient's dysplasia is defined by her sockets, which are shallow and do not completely cover the ball of the ball and socket joint. Jody had worse x-rays on the right. However, on the left, she had more pain. Because she had residual joint space, we explored options that didn't involve joint replacement, obtaining an MRI, and sending her to a colleague of mine for evaluation for possible hip arthroscopy to evaluate if the soft tissues in the hip could be repaired. Unfortunately, she was not a candidate for this. The other option for her would have been potential osteotomies. However, with her age and MRI findings, she was likely not a good candidate for this. Based on Jody's severe disease, we did talk about options such as corticosteroid injections. However, with her dysfunction, Jody wanted to proceed with total hip replacement. I approached Jody about potentially doing a bilateral hip replacement based on her age and health. I felt she was a good candidate, and studies would show that these do fairly well when done at the same time. The advantage of the direct anterior approach is it allows us to do it under one anesthesia without having to reposition the patient.
I decided to do a bilateral hip replacement just so that I would not have to go through surgery twice, miss work twice, physical therapy twice. It was much easier for me and for where I was at in life to be able to do both hips at once and get it over with and move forward.
Here we see Jody's post-operative x-rays, 6 weeks from surgery with both hips replaced. Here is a photo of Jody and myself at a local downtown runaround. I ran about 5 miles in this race. This was 2 days before her 3-month post-op visit. And this is Jody walking in my office without a limp at her 3-month appointment after bilateral total hip replacements anteriorly.
My quality of life has changed significantly. Thank you, Dr. Widmer.
If you would like to explore direct anterior total hip replacement, please call Worcester Orthopedics 330-804-9712, offices in Worcester, Orville, and Millersburg.